The best role of PET-CT is an assessment of response to treatment. So after giving radiotherapy or chemotherapy, we really don't know whether patient has been responded or not, because every carcinoma patient will be presented with different genetic profiles and different kind of inbuilt hereditary characters. So after doing PET-CT or after doing chemotherapy or radiotherapy, when we have do the PET-CT, whether the chemo has been worked or not, whether the radiotherapy has been worked or not, should be only done by PET-CT. No CT or MRI will be helpful in that character. Only PET. Only PET only will help you whether the treatment has success or not on. So PET-CT is recommended 4 to 6 weeks after chemotherapy, 12 to 16 weeks after radiotherapy. It has a very high negative predictive value of 97%. And the positive predictive value is very less. But if a PET-CT says it is a negative, then you can be considered that 97% it can be only negative. This is a baseline PET-CT of CA upper cervical esophagus, CA glottis, which showed 4 weeks of chemotherapy and 12 weeks of CT. The extreme right image showing complete response to the treatment after chemotherapy and radiotherapy. This is another case of carcinoma supraglottis, the baseline PET showing on the left side. And this is a post 12 cycles of chemo and radiotherapy on the extreme right, which showing there is a complete disappearance of the supraglottic carcinoma. This is another classical case of nasopharynx. See, on the left image, he was presented with extensive bulky primary with a bulky nodal metastasis. On the right side, it shows there is a complete response of the disease. So PET-CT is very helpful in monitoring the therapy response in head and neck cancers. If we go through the published data, most of the studies have shown that approximately extreme negative predictive values when compared to the CTs or MRIs. This was a study conducted by Tejpal, which showed that there was a sensitivity and specificity of 70 to 89%, and the negative predictive value is 95% in head and neck cancers. So there is one criteria which is called HOPKINS criteria, which is used for the reporting of head and neck cancers. I don't think it will be reliable here to discuss it. This is one of the criteria. Okay. So this is at the end of the nutshell is after end of chemotherapy or radiotherapy, 4 to 8 weeks clinical assessment is needed. If you see that there is no response in the clinical assessment only, you can go for CT or MRI. If you need a complete response, you have to send it to the PET-CT after 10 to 14 weeks. These are the lymph nodes, no lymph node, or if the lymph node is less than 1 centimeter and PET is negative, you can't do anything. If lymph node is less than 1 centimeter and PET-CT is positive, you can observe, or you can go for a neck nodal dissection. If a lymph node is later than 1 centimeter PET negative, it depends on the individual treating physician, whether he will go for observation, or either will go for lymph nodal dissection, or he will wait for another few weeks, or he will go for a FNAC and go for it. If it is greater than 1 centimeter and the PET shows positive, then you have to go for a neck dissection. This is a study conducted by Akram and all, which showed that PET-CT is very helpful in the detection of recurrent diseases in head and neck cancers. So this is a case of CA tongue with recurrence. This is another case of tongue with recurrence and neck nodal metastasis. This is a study showing that PET-CT really improves in the treatment detection of PET post-operative recurrences in head and neck cancers. Okay. In recurrence cases, the sensitivity is approximately 100%, specificity is 85%. So what are the guidelines we are saying? Okay, we always follow the NCCN guidelines. PET-CT is definitely indicated in occult primary. Initial staging of cancer of the oral cavity, oropharynx, hypopharynx, consider doing PET-CT for stage 3 and stage 4 disease. And initial stages of mucosal melanoma also. According to the WHO 2 and 3, N2 and 3 of the nasopharynx, PET-CT is definitely must. And the PET-CT is importantly should be used for post-treatment evaluation of the head and neck cancers. So these are the guidelines. These are the nutshell benefits. Initial staging to rule out any regional nodal metastases are present or not. Detection of recurrent metastasis to find out any synchronous primaries, to find out unknown primary with neck nodal metastasis. It is absolutely useful to differentiate responders from non-responders from surgery, RT, or radiotherapy. For surveillance purpose, to suggest to any recurrence, to detect any metastatic disease, or to detect a setting a known primary. This is the role of head and neck cancers in PET CT. Thank you.